Welcome, and thank you for taking a few moments to learn how you can take charge of your health by using therapeutic massage. The first step in learning to use therapeutic massage properly is to come to the understanding that you and you alone are in charge of and responsible for your health. Therapeutic massage, nor any other treatment for that matter, can give you health. What therapeutic massage can do, though, is keep your muscles and related soft tissues functioning properly, so that the normal stresses and strains of life take less of a toll on your overall health and well-being. The point is, therapeutic massage does work, and there's no doubt it will make you feel better. But if you truly want to experience the health benefits of therapeutic massage, you need to know how to use it with a clear purpose in mind. So, what do you need to know to take charge of your health? In order to take charge, you need to first of all know how normal muscle function contributes to good health and how impaired muscle function contributes to bad health. The second thing you should be able to do is identify some of the most common types of muscle impairment and their symptoms. The third thing, and this is very important, you need to be able to define, then communicate your health goals to your therapist. Only then can you implement a specific treatment program that will remove any muscle impairments and help you reach your objectives. So let's get started by showing you about muscle function, as well as how and what types of impairments occur, their symptoms, and their effects on your health. Your muscular system is made up of voluntary, striated skeletal muscles. There are two other types of muscle in your body: involuntary smooth muscle, like that found in the digestive system, and the cardiac muscle found in the heart. But since therapeutic massage has no direct influence on these types of muscle tissue, we will focus our attention on skeletal muscles. The purpose of skeletal muscle is to move your bones and joints and to maintain your posture. These muscles, which are under your conscious control, operate according to a very simple principle. They contract when needed and relax when not needed. When this process is functioning properly, each muscle works not only to move you and maintain your posture. The actual contraction and relaxation of the individual muscle fibers creates a pumping effect within the muscle, which assists the circulation of nutrients and the removal of metabolic wastes. Furthermore, when all the skeletal muscles are used regularly, their combined movements help both your circulatory and lymphatic systems pump the nutrients and waste byproducts of a healthy metabolism throughout your body. Unfortunately, as simple as muscle operation is, there are numerous everyday habits and activities which can impair their function and eventually lead to reductions in your health and well-being. Impairments can occur when muscles become irritated or damaged as a result of traumatic disease or injury or through biochemical or nerve interference. There's little anyone can do to control these causes of muscle impairment. However, the most common causes are under your control. For most of us, those childhood days of carefree play, with their endless variety of constantly changing activities, are gone. As we matured, our activities became more specialized. These specialized activities, which require focused blocks of time where we use specific muscles to perform specific tasks, cause most muscle impairments. The most common ways we use and impair our muscles has to do with overuse, but overuse in two completely opposite ways. The first is called sustained isometric contraction, or static muscle tension. Static muscle tension occurs whenever you have to maintain a fixed posture for an extended period of time. Examples include occupations which require extensive sitting or standing, playing a sport, or pursuing a favorite hobby. Even such mundane activities as carrying a purse or briefcase create static muscle tension conditions. When you do these activities for hours at a time, day after day, the involved muscles lose their ability to relax properly and develop what has been described as a memory for the static muscle tension position. Other activities will cause pain as you attempt to stretch the muscles outside their muscle memory boundaries. The result is that you will have to use other muscles to compensate for the limited range of motion of those muscles impaired by the static muscle tension. Another common overuse of muscles in everyday life is called repetitive strain. Repetitive strain is common for people who have to perform a single or series of identical or similar tasks over and over throughout the day, such as working on an assembly line, typing at a keyboard, scanning groceries, playing a musical instrument, anything where a specific way of moving your muscles is repeated endlessly all day. Eventually, the muscles become fatigued and their related soft tissues, tendons, ligaments, and connective tissue, become inflamed and extremely painful to move or touch. In fact, because persons suffering from repetitive strain impairment exhibit such a vast range of painful symptoms, it is often referred to as repetitive strain syndrome. However, whether these two common causes of muscle impairment apply to you or not, the fact remains, no matter how you live your life, whether you exercise or not, for one reason or another, your muscles will become to some degree impaired. When they do become impaired, either from overuse, improper use, or even underuse, you will consciously or unconsciously alter your behaviors, habits, or lifestyle to avoid the pain of using them. Unfortunately, this is a slippery slope because muscles always act in opposing groups. So an impairment in one group of muscles will place a burden on another group, which in turn will affect another group, and so on. Eventually, if left untreated, aside from being annoyingly painful and restricting, your entire muscular system becomes impaired, forcing it to expend far more energy to accomplish a task than does a non-impaired muscular system. Ultimately, because your body has only a finite amount of energy, it will not go on subsidizing one body system without another body system eventually being shortchanged. One last point about the symptoms of muscle impairment. When several groups of muscles have been impaired for extended periods of time, either as a result of improper usage, favoring painful joints, or as a result of disease, their symptoms can mimic, mask, interfere, or even be confused with the symptoms of many other diseases. The lesson here is if you have a chronic condition which has eluded accurate diagnosis, if you can, use massage to remove any muscle-related symptoms which may be interfering with your physician's attempts to give you a proper diagnosis. Now that you know how to identify some common causes and effects of muscle impairment, you can establish your health objectives and implement your treatment program. This is the most important part of learning to use therapeutic massage properly. People who go to their therapists and simply let them find all the painful areas to work on are not experiencing therapeutic massage's full healing potential. You must decide before therapy begins what you want to achieve in terms of improved health, reduced pain, injury prevention, increased performance, or mobility. Once you decide what you want, then you must tell your goal to your therapist in the clearest possible terms. This gives your therapist the ability to focus his or her attention on those muscles and soft tissue impairments that stand in the way of your goals, or that will most likely take the greatest strains as you move toward your goals. Your goals can be as modest as being able to get out of bed in the morning without wincing, to more lofty goals like preparing for an injury-free mountain climbing expedition. Remember, therapeutic massage cannot give you good health. The goal of therapeutic massage is to either maintain your muscles and soft tissues at or return them to a state of normal balance and function. If you are new to therapeutic massage, establishing normal function usually takes at least a few treatments. And if you are like most people that haven't experienced normal muscle function in several years, you will think you've been given a new lease on life when you do. From that point, you can create new goals, since you'll probably be able to do many things you haven't done in years. By the fourth treatment, you will have built a firm foundation for an effective, dynamic program. The specifics of your program will now keep pace with your ever-changing lifestyle. It's at this point that your program really begins to act as a positive counterbalance to the variety of new activities which will be placing undue stress, strain, and irritation on your muscles. Remember, your therapeutic massage program will be unique and specific to your needs. So expect and welcome change from treatment to treatment as you monitor your progress and make new goals for health and wellness. Thank you, and remember to take good care of yourself with therapeutic massage.